Hey, everybody. We are coming to you live from New York City today, and we are taking your calls. We'll be out on Twitter Spaces. Also, I'm watching the Restream and, of course, the Rumble Rants. But anything you guys want to talk about, I am up to talk about today. I've got a few things on my mind. There's been a polio outbreak here in New York, and that should have people very concerned. That is a really serious illness, and it affects children. So if your kids were not vaccinated or they missed their vaccines, make sure you get that vaccine. And a lot being made of monkeypox here, and yet does not look like it is a serious problem. A lot of people getting the vaccine, which is appropriate. And it's still limited to a risk population, and that population should be highly vaccinated. So that's what we're trying to do right now. So in any event, we'll take your calls. We'll talk about anything you guys want to talk about. Anything else on your mind? It doesn't have to be necessarily medically related. We can talk about mental health stuff, relationship stuff. I see a few other things people are suggesting on the Restream. So let's get to all that. But do call me on Restream. Raise your hand. You'll be streaming out on multiple platforms. We'll do that just after this.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want to help stop it, I can help. I got a lot to say. I got a lot more to say.
We start off with a very interesting question that Jehep put up on the... How's the sound here, by the way, Susan? It seems a little echoey to me. Good? You all right?
Sounds good to me.
Okay, good. He put an interesting question out on the Rumble Rants. He asked, recently a friend of mine had an organ transplant, and their doctor told them to avoid contact with unvaccinated people. Why would they say that? And Jehep, I have JHEP, we call him Jehep, is his handle. I find that odd as well. Obviously, he would want to stay away from anybody with COVID, and he's immunosuppressed, and so COVID has a much more significant meaning for him or her than the average person with COVID. But vaccinated people as well as unvaccinated are likely to spread it. It is so super duper clear now. I mean, one thing that's sort of inarguable, which is that the vaccine doesn't prevent COVID, and it doesn't prevent transmission. So this idea that you heard people exclaiming that the stops with the vaccine and you must get the vaccine because it stops the spread, not true. It does still appear to be the case, and this is where a lot of the controversy is sort of bearing out, is it still appears that even though the vaccine that is available is not specific to the variant that's flying around right now, which is the Omicron BA4, BA5, which, by the way, there will be a vaccine for in about 2 or 3 months by the time BA4 and BA5 is gone, and which is an interesting question whether we should be taking that or not. But the Alpha and Delta variants do give you some T-cell immunity against the illness. So it still appears to be the case. Now, again, this is somewhat controversial, and Dr. Kelly Victory and I are going to hash this out on Wednesdays at 3 o'clock. Our first show will be this Wednesday. As our first guest, Alex Berenson. Susan, you got to get ready to get up on the mic here. Is that a yes?
Jehep.
Jehep,
it's a yes.
Is that a yes? Alex Berenson is our first guest, and he has lots of data at his disposal. He's been wrong a lot, and he's been right a lot. Good. I like talking to people that have interesting points of view. I'm hoping also to get out of him what was in the nature of his suit against Twitter and what he got out of it. I mean, really what happened there. I'm anxious to know. Yes, people are saying, oh, rest in peace, Olivia Newton-John. Those of you who don't know, Olivia Newton-John just died at age 72 of, I believe, breast cancer, which she's been she's been dealing with quite nicely for 20 years.
I hope it wasn't COVID.
I hope not too.
It was probably cancer, though.
But, well, even if it's, look, she has advanced cancer and she got COVID and died. What would you call that? A COVID death or a cancer death?
I know. I'm reading that book, I'm still reading it. I don't read very often, but
she's reading a book by one of our former guests.
Yeah. So they were talking about how when everybody was dying, if they had COVID but they were dying of something else, if they said they died of COVID, they would get $9,000 towards their funeral arrangements.
Oh,
There was like this whole thing where
Yeah.
they were promoting the COVID, and a lot of the deaths weren't actually COVID.
I understand that, but again, Naomi Wolf also wrote a book called Bodies of Others that is extraordinary. I hope to get her on here soon, also maybe in one of the days with.
But I'm not saying that Olivia Newton-John had COVID when she died.
I
But if she
understand.
did, I would rather say I died of cancer, especially if I was battling it for as long as she had.
Which book, Susan?
Because
Snake oil.
that's snake oil science, right? Snake oil,
thought so.
just snake oil.
It's called snake oil.
Okay. Mine is Body of Others with Naomi Wolf, which is, I don't agree with everything she has on there, but it's kind of an extraordinary analysis, way of thinking about things. And you got to understand, if you have advanced stage or advanced cancer, something is going to take you out in all probability. Some pneumonia, some urine, something is going to get you because you're in a highly debilitated state. There's the snake oil. What's the Michael Sanger who wrote that? The interesting gentleman we interviewed. Again, controversial guy. I like talking to controversial people. For me to talk to people that agree with me does not expand my point of view. I want to talk to people that have differing points of view. And Kelly has a different point of view than me, and that's why we're going to bring her in here regularly on Wednesdays at 3. And we will have some controversial people that she and I will be interviewing. My bet is we'll have to retreat to Rumble, probably, Susan, in all cases, with those interviews. Yeah. So you will start here.
So go over to Rumble, check it out, sign up.
Yeah,
get yourself in there.
We'll start on these platforms.
Join JHEP.
And will we be able to take calls from Rumble? Is that, on
Twitter?
Yeah.
We'll be able to do it.
So same situation with Twitter Spaces, but we will head over to Rumble because we'll get kicked off.
We'll
YouTube.
be on Facebook for a while. We'll see how long this lasts, but it could be interesting.
Yeah.
Well, we're going to stay on YouTube as long as we can, and then, but we'll open up on YouTube. We'll let everybody know so you have time to get over there and join the conversation.
And I know people are very wound up about the vaccine right now. And my general position is that I'm just concerned. If there's a little bit of noise out there, a lot of noise out there, and if that noise ends up to be something real, I don't want to be on the wrong side of that. So I am just trying to evaluate this. And there are people that know more about it or make more focus on it than I do. And I like to hear what they have to say. So that'll be that. Certainly, there does seem to be some concerns out there. Other thing, like I said about monkeypox here, the fact that people are panicking over that is bizarre. Let's remind ourselves that apparently this data is circulating around that 51% of the people with monkeypox have HIV also, making it a much more serious condition. And also, except for a very tiny number of cases, limited to a risk population. It appears to be transmitted by skin-to-skin contact only. Of course, there's potential of surface transmission. Of course, there's potential of some sort of respiratory transmission. Does not seem to be a means of transmission that is happening. Does not happen that way. It's happening from skin-to-skin contact. And at this point, thankfully, if you're in that risk category, it's not so thankfully, but it's staying in a risk group, and we can focus on that risk group. If we can't say what the risk group is, how can we focus on them and make sure we help them adjust their behavior, reduce their risk, and get them vaccinated? If you start vaccinating everybody, the gay men who are at risk are not going to get the vaccine. So here in New York, getting the vaccine is kind of a big deal, and people are getting it, and that's good news. I've heard less concerns about the lack of availability of the vaccine. It seems like it's available here. People are getting it.
Yeah, how long did it take to make the vaccine? Has it been around for a long time?
It's been around. It's just not in quantities that they needed. And so there was a couple of weeks ago concern that the men couldn't get it. Now it seems to be getting. And by the way, it's not technically it's not necessarily just men that identify as gay. It's men who have sex with men. So skin contact. That's all. All right. And so. David Gorski.
What about polio?
So polio has been reported here in New York. That is to me, of all the stories that have come and gone, including COVID this year, right? If you want to make an issue of a serious outbreak, polio is a freaking serious thing. It is highly transmissible, and it destroys children. And if you want to worry about something, that's the one we'd be worried about. If you have missed the childhood vaccines, particularly polio, obviously, because of the pandemic and you didn't take your kid in, or you know somebody whose child needs to get their vaccines updated, please, for God's sakes, get the vaccine updated. And if somebody has become generally vaccine resistance because of all the manner in which the COVID vaccine was sort of shrouded and made people paranoid, Caleb, you taught me about that, which is that the more they don't tell you the information, the more people run to conspiracy theories, right? Have I got that kind of right?
Yep, exactly.
Okay,
That's why I'm excited for Dr. Victory to come on, because if someone believes that they're wrong, then bring it to the light. Let it be exposed. Don't try to hide it, because then people think there's a conspiracy.
That's exactly right. And so in any event, so polio is a major deal. And in the fact that is not being trumpeted by the press as frequently as monkeypox. Monkeypox rolls off the tongue better. It sounds more dramatic. Polio is dramatic. It is destroying children, and it's highly contagious. And there's a vaccine, and people are under-vaccinated. And if we don't get that vaccine out there, we are going to have a very serious problem. And again, I don't understand. Again, it's the press determining the relative importance of something, and they have no fucking judgment on this. So, sorry, but that's the way it is. If we only had a great Tom Cigars, by the way, wants a cure for his Asian brain, which I don't have for you, Toms. Sorry. And also he says the reports. Oh, no. He goes, we need more. No. Oh, shoot. Where are you, Toms? You said something very funny. Oh, if only we had a great polio vaccine. Oh, wait a minute. Yeah, we do have one. Thank you. But it requires, you have to it requires a series of vaccines to get it properly updated, as I understand it. Okay. Let me look at what you guys are saying here, and then maybe we'll get to some phone calls in a second. Tough week, Jehep. My better half lost her brother-in-law yesterday. He was only 41. What happened? What happened there? Now everyone's blaming the vaccine. Vaccine is a dead version of the virus, not a gene therapy. It can be a dead version of the virus, or it can be an attenuated version of the virus, or it can be just a protein like Novavax, or it can be an mRNA, which is the mRNA vaccines, obviously. Mom is asking for an eye autopsy. SGT Justice, I am worried about myocarditis and pericarditis. Well, pericarditis is not as dangerous as myocarditis. And so I'm just worried about it. And so I want to be on top of it if that turns out to be a significant issue. And so again, in the upcoming weeks, we will be talking to McCullough and Corey and who else? We got Malone. We're going to get him in here and see what he's got to say. And these are skeptics. They are, who else? Yep. All right, let's go to some calls here. See who's interested in coming up here.
I love how you still call it calls.
These are calls.
Like a radio.
What should we call them?
I don't know.
They're calls.
It has to have a new version.
Linda, you've got to unmute your mic there, and you can just speak away, and we'll get your questions. There you are.
Hi.
Hey there.
I have a nephew who has made himself estranged from the family, and I just found out he's doing methamphetamines and fentanyl.
Right.
And he's blocked us all, so none of us can reach out to him. And what do we do? And they say he looks really bad.
Yeah, it is rough. And unfortunately, you're not allowed to do anything to help him if he says he doesn't want help. There's this bizarre phenomenon in most states now where the patient can choose. He's choosing to do it. Not that he's sick and the meth has a grip on him and he can't see what he's doing, what's happening to him. It's actually a neurobiological process called anosognosia, and he's got that for sure. It's bad enough with the fentanyl, right? Because that's a very hard chemical to get recovery from. People really have a very high potential to go back to it. But the meth is so distorting, causes so much paranoia, causes them to withdraw and shut down and be unwilling to talk to anybody. And they sometimes get violent. Now, if they get violent, then you can do something, strangely enough. But once they settle down, if they say, I do not want to kill myself, I do not want to kill somebody else, back out on the street or wherever they go, which is this is not healthcare. This is disgusting. Fentanyl obviously has the huge risk of overdose, accidental associated with it. You just easily get too much and stop breathing. Methamphetamine, like I said, it will make you paranoid and agitated and, very delusional, all kinds. And the delusions are always focused on family, friends, neighbors, and coworkers. So he's thinking things about you all that you're trying to get him or whatever. That's all delusional. And the thing about meth is that when people die of meth, it comes later. It just comes, and so it's like they can kind of go along with these delusions and craziness for long periods of time, and then suddenly die of something. And what they die of is often sort of a cardiovascular death. What you can do, you can attempt an intervention. Have you ever tried anything like that, a formal intervention?
No, like I said, he just cut us all off.
And you don't know where he's living?
No.
Yeah,
I know he's in town.
Which is where? What town?
Colorado Springs.
Yeah. It's probably on the
And
street.
also,
that's where the meth drives them. They just go to the street. They just go out. That's just what they do.
And then, he's lost his job and he's got DUIs now and he got domestic violence charges. And so, and no, we don't know where he is, and he's blocked us all from everything.
The luckiest thing that could happen is if the law enforcement actually gets him for something, and that you could find an enlightened judge to appeal to say, look, mandate a year of some sort of treatment. Get him into something treatment. This is not his normal state. He's altered by the drugs. He's getting the usual methamphetamine aggression and violence, and see if you can get a judge to help you.
So just show up at a court hearing?
If he gets if he gets in really serious trouble, jail's not going to help him. He might dry him out a little bit, but there are drugs in jail too. But if you can get an enlightened judge to refer him to mandated treatment, that would be the best. That'd be the best possible thing. Okay?
Okay.
All right.
All right.
Luck. All right, you got it.
Thank you.
You bet.
Bye.
How do you do that, though? You have to, find the prosecuting attorney and try to...
No, you have to appeal to the judge.
But how do you get to the judge? You just show up in court?
You show up at the hearing. You show up at the hearing
and
go,
raise your hand? Or
I ask his attorney, and
you have to talk to an attorney.
Well, he will have an attorney, whether assigned or hired.
Right.
And you talk to that attorney. And
you have to find... And how do you find out he's in jail and find out who his attorney is?
Well, that's the hard part. That is the hard part. Because like I was saying, you hope that the legal system
might already
catches
be
up
in jail as far as she knows.
Again, I don't know exactly how you do that, but that at least gives her a frame of something to do. It's so disgusting that you can't help people you love. It is disgusting. There should be something called gravely disabled. And the legal system has eviscerated gravely disabled, which used to allow us to put people in treatment and make them better. And they would always look back and go, what the hell? Who left me like that? Who left me in the street? Who did that? My God. What Anthony called thinking, I think is what this is called. This is Anthony, and go ahead and click on your microphone. There you are. What's up, Anthony? We can't hear you quite yet. There you are. You're muted. Anthony, you got to click the microphone in the lower left-hand corner of your phone, and that will get you.
Yeah, got it.
There you are.
Oh, got it. Awesome. Oh, fuck. I love you, Dr. Drew.
Very kind.
Heil Hitler.
It's not Heil Hitler. That's going a little too far.
Sorry. Sorry.
Hey, Hitler.
No, I didn't mean that. Yeah. I meant Hi Hitler.
Hi Hitler, right. Which is, I have to explain this to everybody every time because people get so confused about this. This is at your mom's house.
Yeah, exactly.
This is a girl who is delusional and thinks she's talking to Hitler every day. And she does a video blog where she goes, hi Hitler. So anyway, there we are.
So I'm a mommy, and well, I'm not, but I know. I had in my youth, so I'm now like 34. In my youth, I got hooked on pills after dental bullshit.
Yep.
Sorry.
Yep.
Apologies for my language.
All good.
I think that's okay here. Yeah. Anyway, Um, I recently broke my collar, or clavicle. So yeah, so clavicle, so where it should be, I'll just give you the down low on the clavicle, where it should be, 3 o'clock. It became 2 o'clock.
Yeah. So you got strung out on opiates again.
Well, no. I only recently had it. God, it's such a nonsense thing, and it added up because I was supposed to have like orthodontics like within this month, and then I was supposed to have.
So Anthony, let's get to what the question is. What's your question?
Yeah. Okay. The point is, I was supposed to have orthodontics. Then I was supposed to have like dental shit, and blah blah blah. Anyway, this crack or fracture or break in my clavicle, where I now have, I've got to be on painkillers.
You do not have to be on. You've gotten on painkillers. You do not have to be on painkillers.
Okay. No. Well, yes. However,
how long have you been on them? How long have you been on them?
Well, I was actually free from them.
How long have you been on them this time? How long?
Okay, I've been on them for probably what would you call it? Yeah, like sorry, my brain's not working. It's actually midnight here. I'm in Australia.
2 weeks or 2 months? 2 weeks or 2 months?
2 months.
Yeah, which is ridiculous. My friend, is ridiculous. For a clavicle fracture, that's insane. So your doctor needs to get you off the opiates.
No. To be fair, I went through the public system, and then the doctors were like, "Look, you guys should go, or I should go through the private system. That I'm not waiting on, because I don't know if you know how the public system works in Australia, but it's basically like, you can be here and there and blah, blah, blah. You can turn up every morning, except once, someone has, or eventually every morning,
here's what you need to do.
Some woman is going to break her hip or whatever, and blah, blah, blah.
Okay,
but
so here we go.
My issue is, I'm not actually on opioids. I'm on this new thing called tapentadol. And I don't know if you know much about that.
I'm looking it up.
Because
it's not here.
Yeah.
Tapentadol is a sort of treat pain severity.
Polexia.
It's an opioid. It's just another opioid.
Yeah.
It's just another one.
Doesn't.
It's Nucenta.
Yeah.
It's a rather strong opioid, though. The idea that this is not opioid is insane. It's a strong opioid.
Yeah.
If you want to get on something that will help you and help you get off all this stuff, you need to get on Suboxone.
Well,
you need to get on some form of Suboxone. It will help you with the pain.
No, I'm already on Suboxone. So they're saying, like, okay, get on tapentadol that way, because tramadol is
This is all about this is not about pain. Let's be clear. Let's be super clear.
Tramadol is dirtier than tapentadol, so
it's weaker. It's weaker. It doesn't really matter. It's a little weaker. We can't go all day. This is all about your addiction. This is not about pain. A clavicle fracture does not cause too much of pain. It just does not. So the pain you're experiencing is something called hyperalgesia from all the opioids. They should just boost up your Suboxone, give you what you need for whatever control of the symptoms you're having, and then taper it down. That's what they should do. The fact that they're giving you multiple things on top of this is insane. And you're going to really accidentally get into trouble with this. That's what's going to happen. Somebody's going to give you a sleeping medicine or benzodiazepine on top of it, and then you're going to stop breathing. This is not fooling around. This is really serious, and you need to deal with it accordingly. And if you can go to a program or someplace, they're available on Zoom, it's all over the place, raise your hand and say, I need some support, get the support you need. But this is not good situation.
So when you
very
say
concerned about
Suboxone and something that'll help, like Motrin or Tylenol, or
right, well, just boost the Suboxone up. Just boost it up if
'cause
you're having trouble, and then bring it back down.
doesn't that help with pain? Like
Suboxone?
no, Motrin.
Yeah, but this is not about pain. This is not about pain. This is
Yeah.
opioids cause perpetuated pain.
We know that the
Yeah.
pain's coming from taking the
From
opioids.
taking the pills. That's exactly right. So
But the Suboxone will help him wean off of the
and
opioids.
get the symptoms under
Or her.
control. Suboxone has an uncanny
She.
ability in people with chronic pain, which is sort of with his category.
Right. This is a perfect example of
Yeah,
that.
you boost it up and they get better control, and then they're able to bring it back down.
And don't take any benzos
No, God, no.
or
God,
any
no.
sleeping pills.
God, no.
Please.
Yes, God, no. Please, no.
We want you to come back and
So we'll see.
say hello again.
We'll see. I'm trying to help my friend. We can go all day around about it, but that's it. That is my advice.
Well, we can
and I
see
understand the
that-
system sucks, and I understand it's frustrating. I get it. I get what you're saying. But
This individual is suffering.
They are not doing a good job, and it's dangerous what they're doing with you. I'm sorry.
crazy.
So I have strong opinions about addicts who get opioids and what happens to them. They're all dying, and it's not no fault of yours. You got strung out on, you said, after the dental shit back when you were a kid, and that was not your fault. But now you've got this thing, and you have to deal with it. I have to deal with it. There was something. My God, SGT Justice. I wish CBT was all you needed for pain for a case like this. My God, would that be an interesting thing? And no, the I word and hydroxychloroquine are not the medicines of the future. They have been a medicine. They've been available for many, many decades, and we've been using them like crazy the way they're supposed to use, which is the CDC forces you to take the eye medicine if you come in here for a week. If you come in here as a refugee, you're required to take it for a week. And if you have systemic lupus erythematosus and you're a young female, your first medicine you're going to get chronically on is hydroxychloroquine, and you're going to stay on it. Pill rollers are not your friend. That's true. That's true. He's saying be careful of doctors that hand you pills. It's really true. Yeah, he's really true. Okay. Let's keep going here.
I was thinking of those little roly-polies, pill rollers.
No, that's a pill bug. Amy, let's see what you got here. Amy, go ahead. Amy.
Okay, hi.
Hey.
I have two questions, if that's okay. Because I was listening to you in the first one, I think you were saying about addicts that there was a severe disability there used to be. Did that end in 2009 or
It's what? Ended. It's been systematically disemboweled, really, disempowered. You used to be able to hold people against their will because their brain wasn't working right. If they were A, suicidal, B, homicidal, or C, gravely disabled, meaning they couldn't take care of their daily needs, they're delusional, their judgment is off, they don't see what's happening to them as a result of their mental illness. That's basically gravely disabled. And gravely disabled is fueled by what we kind of commonly call denial, but actually in serious mental illness is actually a biological process called anosognosia. And maybe Caleb can throw anosognosia definition up there on the screen. It's a neurobiological process that blocks our ability to see what the illness is happening to us. We just literally can't see it. And so when somebody's in that state, and of course the addicted state, they choose to keep chasing drugs. That's not a choice. That is a biological imperative that they can't get out from under unless they get some help from somebody. And what I keep telling everyone is how odd that we have a requirement to treat dementia patients. You literally would be guilty of elder abuse if you didn't treat a dementia patient. Nothing I can do can change the course of dementia, really. It's an inexorable process. But it's so even when I treat that person, which I'm required to do, they're going to continue to deteriorate. But say schizophrenia, is an illness that's highly treatable. If you arrest it early, they do rather well. And if you let it go unchecked, they're irretrievably damaged. And the same is true of addiction. And yet the two illnesses where we can change the course, we're not allowed to help. And we prioritize the grave disability that these illnesses caused. We literally give a legal status to a brain condition called anosognosia, unless it's caused by dementia, in which case magically we have to jump in. If it's caused by another brain disorder, they choose it. It's so crazy. It's super crazy.
Well, it's that fine line, like with conservatorships or 5150. I mean, it can be abused and has been abused.
Of course it can, but yeah, of course it can, and it needs to be highly done carefully and skillfully and professionally. But the reality is, addiction is a progressive illness that ends in death. So if you do not treat them, they are going to die. And on the streets of California right now, they are dying of just LA County, 6 to 7 per day dying. People who could have been helped dying. If this were a hospital, it would be sued out of existence tomorrow, or it was shut down. But we've allowed this to happen on our streets.
And I've watched you fighting for 30, or I think 30,
for a long time.
More than 30. Yeah, I've been listening to you. And so I'm wondering, we had those, the forced interventions and those didn't work. And you've been doing this for so long. Mm-hmm. What is addiction? It is different than schizophrenia. It is different than, dementia. It's its own thing. And I think it may need to have its own category, because what is that word that you called it?
Anosognosia.
Anosognosia.
Yeah.
Anosognosia, when you're on, and no offense to the previous caller, but I'm just not so sure they're aware of their cognitive abilities at the moment. And it is freaking tragic the way you were talking about, just please don't take any sleeping medications, because they could die just by taking a Sudafed, probably. I don't know if that's true.
Not
is that
Sudafed,
true?
But an Ambien. An Ambien will do it. And
oh my gosh.
And anosognosia is that block. So the reason he couldn't see what was going on, was arguing with me and obfuscating and all that you were watching anosognosia. That's the condition. And there are ways to work with it and get it, but you have to have them. You have to hold them somewhere. You have to keep them somewhere and work with them and get them motivated. And your point is well taken on addiction is a different category, because it's a disorder of motivation. The fundamental motivational states of the brain, survival, eating, loving your family, get taken over by another priority, which is use no matter what. And then all the other brain mechanisms, all the other things that sit on top of those motivational systems get used. So your thinking, your relating, your emotions all get used by the motivational system to get back to the drugs. And that goes on for a long time. It's very powerful for, many, many months after people try to get off drugs.
And it's so distinctive now too, that we've had this history with it. I mean, you could recognize, I'm just listening to you. Mm-hmm. You recognize on the phone what this person was taking, what they needed to do, what they shouldn't do, just by listening to them speak.
Yeah, it's pretty easy. It's pretty straightforward.
So this is where drugs, and then this is where I think they have to, the drugs and the mental illness, we have to separate the schizophrenia, because each drug, like the way you're able to identify opioids, I mean, opioids should be its own subcategory or whatever. I don't know.
It is. Just, it is. We address it accordingly. The thing that people are just not getting their head around, though, is meth and the destruction it's doing to people. And that's not going to really come to bear for a couple more years. In a couple more years, watch what happens in Los Angeles. It's going to be a frickin' catastrophe. You're going to have people violent all the time, and you're going to have people just dying, just dead all of a sudden. Not of overdose, just of something. And those somethings are caused by the meth. And I've seen it. I mean, it's one of the interesting things about addiction. It's so highly predictable. It's highly, highly predictable. And that's kind of nice, and it's also very disturbing when you can't get after it. And all the people that are advocating for people who are living their best lives on the streets, doing drugs, themselves are in denial about the fact that these are progressive illnesses that, if allowed to run unchecked, end in death. That's the natural history of addiction. Death, prison, institutions. You're not allowed to go to a prison or institutions anymore, so you're going to die. And that's the way it is. That's the nature of these conditions. And it drives me crazy because I know I could do something about it. That's why I'm always talking about it.
You're a physician and you understand the physiology of it, but it seems that the psychologists are the ones that are handling it. And they have no idea. There was no way I could recognize what you heard in that caller's voice.
Yeah.
And I have a master's in psychology. I have no idea about anything you were talking about, all those drugs. Yeah. And yet psychology is the one the courts are sending the addicts to. All the...
Let me just say, to be fair to psychologists,
it is mixed up.
Let me just be fair to one part of that. And that CB, cognitive behavioral therapy, has a role here. It really does. And the psychologists are the ones that will administer that. And motivational enhancement therapies, those have a role here too. So I welcome my psychiatric and nursing colleagues and psychological colleagues, but you really need people that have lots of experience with addiction, lots and lots and lots of it. You are absolutely right. Thank you for your call, by the way. Most practitioners don't understand addiction, and they don't understand that people can recover. I've literally had my physician peers go, "There's no such thing as recovery from opiate addiction." And I look at Bob Forrest and Shelley and go, "Hello." A lot of my greatest colleagues are recovering opiate addicts, and they all look at me and say, "Geez, if Suboxone were around when I was doing this, I'd be dead." Or if all these other kinds of ways you could get hold of opiates was available, that'd be it. But we again, people are just not realistic. Well, ultimately, because people are so far down the line with addiction now, they're on the streets, they're gravely disabled, they're homicidal, whatever. They're so far down the line that replacement therapies, harm avoidance strategies are all that will work. They're too far gone. We've let them go too far now. So it is quite reasonable to just try to get them not to die because they're going to. They're going to die. But you have to get them in a structured environment for that to happen. They will stop taking their Suboxone, or as you heard with that caller, they'll pile stuff on top of the Suboxone. That's what this guy was doing. All right, we're going to get more calls in a minute. We're going to have to take a little break from our friends at Genucel. Be right back. I think we have found the holy grail of skincare. Genucel has absolutely changed, certainly my skincare regimen. I like that vitamin C serum, the under eye creams, skin nourishing primer. Susan loves the eyelash enhancers, uses it on her eyebrows as well. Genucel has everything to make us both feel and look amazing. Best part, the quality of the products. Using pure ingredients like antioxidants, copper peptides, and a proprietary calendula flower base, Genucel knows how to formulate products to perfection without irritation. For Susan, she hates that annoying dry area under her nose during allergy season, like right here. She's tried everything, but no matter what, the skin is flaky and dry. Nothing seemed to help until she started using Genucel's Silky Smooth XV Moisturizer. It soaked right into the skin. She was hooked after one use and now loves all of their products as well.
I am a snob when it comes to using products on my face. The dermatologist makes a ton of money from me. But when I was introduced to Genucel, I was so happy because it's so affordable and it works great. I was introduced to the Ultra Retinol Cream, which I love at night. All the eye creams are amazing. People notice my skin all the time, and I'm so excited because it's actually working.
Right now, you can try Genucel's most popular collection of products and see what I'm talking about for yourself. Go to Genucel.com and enter code DREW for 10% off. That is GENUCEL.com, and the code is DREW. This was Susan's debut on the Genucel, and she was so excited about this product. She said, I want to talk about it. I really love this stuff. So there you go. So everything good with you?
I have those red patches again. I need more of that XV cream.
Okay. All right. Well, there we go. All right. Let me look what you guys are talking about on the Restream here. Somebody over at Locals, a friend of ours, is concerned about urologists discussing urological symptoms from women who are sexually abused as children. Let me just, I'm going to give a little primer on this. Urologists don't see much of that. Gynecologists see tons of it. And any unexplained pelvic pain or urological pain, when people are getting to diagnoses like interstitial cystitis, which these things do exist, but it's very important to ask that woman, had she had sexual abuse in childhood, what age it occurred, How long did it go? And was there pain associated with the experience? What happens, the way we develop as human beings, is if that was a particularly terrorizing experience, we dissociate as a way of surviving it. Like people feel like they're watching something through a dream state or down a tunnel. That's called dissociation. And people do that normally. It's a normal phenomenon. But if it happens to you early and a lot, it becomes your main means of dealing with all unpleasant emotions, not productive, not regulating. Dissociation is the opposite of regulating. It's just sort of rising above it. But the more insidious thing that happens, if your body has been a source of disorganized, overwhelming information, like a sexual abuse, you get something called somatoform dissociation, where you literally cut off from the body in terms of it being regulated with the rest of your central nervous system. And the body becomes this source of overwhelming content, overwhelming sensory information. And anything that's slightly uncomfortable becomes in your brain, because of this dissociative connection rather than integrated connection, a 12-alarm fire, a disaster. The feeling is that it's overwhelming and shattering. And things that would otherwise be well-regulated and probably not so bothersome for women that have been sexually abused becomes overwhelming and a preoccupation. And doctors, when they don't ask that question, keep treating with all kinds of things, and eventually, this is one of the reasons I brought this up now, get to opiates, which is exactly the wrong thing for this sort of symptomatology. So there you go. So that's sort of the primer in that. But dissociation and somatoform dissociation are the two things you can read about. Dr. Alan Shore is the sort of one of the grandfathers of these constructs and the research behind it. I did interview him. Caleb, maybe you want to talk about where they can find that interview with Dr. Shore on this particular stream. And it was drdrew.com. You can just look up Alan Shore, SCHORE.
Oh, yes.
Is that it?
Easy. Yeah, they'll find it right there. Easy.
So look for Alan Shore, and he's one of my heroes. And he really did a lot of the theoretical framing of dissociation and somatoform dissociation. It turns out a lot of it is mediated through our parasympathetic nervous system, and that is something that develops later. Really, it's sort of the key to some of our emotional integration, our feeling integration. Feelings are things that start in the body, right? Feelings of all types. And when those feelings are overwhelming and disorganized, that's how people get into a lot of trouble. So, and also what happens with that, it's common for there to be character problems that come along with that. Things like borderline personality disorder, that sort of thing, kind of come along with the same phenomenon. And very common in addiction. Very common, because think about it, like I just described to you, eventually they go to a doctor, pain, they get an opiate, and if they have that genetic potential for addiction, it is on at that point.
Bada bing, bada boom.
So,
hey,
hey,
what do you think about Anne Hesh?
I think she's struggling, and I kind of been aware of that for a while, and we'll see what that is. I don't have enough information to know what that is, but I mean, it sounds like intoxication. She drove into one house, then drove out, and then drove into another house. I mean, that sounds like that she needs help, and I hope she gets it. Jason, what's going on?
Hey now, get it on.
Hey now.
Big fan of the Adam and Drew podcast. I assume everyone here listens, but if they don't, they should.
Thank you. Hey, let me ask you, what did we talk about? I saw several people tweeting about something that he and I talked about this last Friday, and I don't remember what we talked about. Did you listen to that pod?
I did, but it was a couple days ago, so I couldn't tell you.
Okay,
right
so
now.
Nothing jumped out at you. Okay, fair enough. All right.
No,
Yeah.
not that I.
All right, good.
And by listening to that show, I learned that Dr. Drew board certified physician managed specialist. So, two questions. One about me at 52. I get like just over 5 hours of sleep, and then bing, I wake up. Is that normal and healthy? Should I be getting more?
Obviously, the sort of prevailing wisdom is that people need 7 to 8 hours of sleep a night. 8 hours is sort of optimal. But I got to tell you, I know plenty of people that do 4 or 5. Lots of people. And they are not having health issues. It's a certain biology that can do that. And it's not normal in the sense that everyone else kind of needs the more 7 or 8 hours, but it's also not pathological in the sense that you're hurting yourself, right?
Right. Yeah, like 5.5, and I'm just oh well, that's enough. So
I mean, just make sure it's not something else you're doing to cause that. I mean, melatonin only lasts 5 hours. If you're drinking alcohol, 5 hours later is when the sleep latency sort of kicks in. You get in trouble. And, so there are a lot of things that can disrupt your sleep you may not be thinking about. So make sure you pay attention to those things. That's all.
Probably the booze has a little bit to do with it. Not an alcoholic or a heavy drinker, but yeah.
I know for me, I'm a ultra super lightweight, so I get everything. But if I drink 2 glasses of wine a night, I can't. It screws up my sleep horribly.
Yeah,
I mean, I can't sleep.
What it is.
I just bad. So not everyone's that way. But go ahead. You're my.
Yeah. And I just wanted to get to the second part before you guys moved on. But second part was on a recent episode of the Adam and Drew show. You had mentioned that if you were going to voluntarily go and get another booster shot or whatever, that you would want to wait until the ones came out that are going to fight the current variants, because the current vaccines fight the older variants, which are still out there, but are not nearly as prevalent as the newer ones. Do you know anything about the timeline and when that's available? And if it's like, how would we, the public, just know that?
They are going to be pushing it. Yeah, they're going to be pushing it in, they're saying maybe September. Now that is going to be, it's a really hard decision to make. I mean, that's why you got to make it with your doctor. It depends on your age and how you've done with COVID and, how much risk tolerance you have. For instance, you could take Novavax right now, and that would give you some T-cell immunity against Omicron and anything else that comes around. And if you had done like really well, like myself, I had Johnson & Johnson, then I had Alpha, then I had Omicron, and I've been around Omicron a lot lately, like stuck in this very room with somebody with Omicron for 3 days, and I did not get it. Then the same thing 2 weeks later with my daughter. I did not get it. Now I may have, maybe I had some viremia or something, but whatever it is, my immune system seems to be handling this just fine. So for me to worry about the BA4 and BA5 seems to be an unfounded concern. So if I needed a vaccine, a booster, I might take Novavax because I like the platform. I like the way I like the whole way that one is set up. And that's kind of why I took Johnson & Johnson, even though I had a terrible reaction to that one. I had a bad reaction to it. So these are really hard decisions. And, that's why I'm uncomfortable with all these mandates, because these are sophisticated decisions. These are medical decisions, and they should not be do it, especially when there's kind of noise around the vaccines and concerns about them until we get that all cleared up.
Yeah, I live in South Florida, and I had the Moderna shot, and then I had 2 boosters, and I've never got COVID, and I live in South Florida where you can go everywhere and everyone's standing shoulder to shoulder. There's no mask. I guess I've been lucky. I don't know, but
no. Maybe you got a very good response to the vaccine, and you're 52, so you don't have much to worry about from COVID. And BA4 and BA5 have been a lot milder. I mean, look, the way I was thinking about BA4 and BA5 last year was I was about to get another booster, and I thought, God, I'd probably be better off if I just got Omicron. And boom, I got it. And it was nothing. It was nothing. And I've had this great immunity now. So you see how these are really serious decisions, and there are good and better ways to make these decisions. It sounds to me like you may need a booster, and you should talk to your doctor about it, because you've had such a great response to the vaccine. You're doing really well. Yeah, you might be sort of in that zone where a booster might be a good idea for someone like you. But not,
well, that was why I was asking the questions, because I'm thinking it's been, I don't know, maybe since April or so, since I had the last booster, and I wanted to know, should I wait?
You had, so you've been boosted also. So you had the boosted twice. Yep. I missed that. I thought you got 2 vaccines. So boosted twice. No, I would hold on till the new vaccine and see what things are like in the fall. I would hold on.
Right.
Yeah.
Okay. Yep. Thanks for all you do, man.
You got it, man. Bye. Yeah, that's kind of easy, that one, because he's doing great. He's had 2 boosts. It's not specifically recommended for a 3rd booster in his age group. That's kind of an easy call, that one. This is Carrie. Let's see what Carrie wants to talk about. Carrie, what's going on?
Nothing much. My issue. I get up several nights to urinate.
Good times. How old are you?
I'm 57.
Does your wife shame you like mine does?
Yeah, I wish. No, it's when I urinate, I have to urinate in the sink. I have to splash water on my chest.
If I peed in the sink, would that be okay? You wouldn't hear it that way. You wouldn't hear it. That's a Corolla move, by the way. That's his thing.
Yeah, get it on, get it on.
Is he married? That's the first question.
Do you have
No.
Yeah, he can do that. He's not married.
So you're 57. How much do you weigh?
About 250.
Okay. And do you have any medical problems? Do you want any medication?
Yes, not for that, just for other stuff like blood pressure, cholesterol.
Which blood pressure?
I can't remember what it is. But what it is, I had a Turk done and a UroLift done, and neither of those helped.
Oh boy. Wow. Well, and you want there's a bunch of fancy medications now to try to help you with that. Have you been all that stuff?
Pretty much, just through the VA and through they can't find out what the hell's going on. I get up there and say, look, I get 4 or 5 hours night sleep. I pee, get up, pee again.
Yeah.
I just splash water. I don't understand why do I have to pee in the sink to splash water to urinate.
Oh yes, you have trouble. You have an urgency to go, and then you have trouble initiating the flow, right?
Right. I just splash water on my toilet. So can you?
Right.
These doctors won't give me I ain't gonna say the word, but a damn answer.
Well, they don't know, right? That's the damn answer.
That's why I'm fucking calling you for.
They don't know, and you have a huge prostate. You've already gotten both those procedures by this point in your life, so you have a big prostate. You have when you're overweight, there's pressure issues that make things even worse. But it sounds like you have. I wonder if you have bladder spasm. Sometimes people, their bladders are really spasmy, and if you take did they ever talk about that?
Yeah, they said something like that, but
yeah, there's a medicine. There are medicines for that. I know it's more meds and whatever, but it could help you. It'll certainly get you down to 1 a night, and not with all that urgency and stuff. It seems to me.
Yeah, it's just like I got to pee in the sink. I get the urge, and I splash water on it, and I pee. An hour later, get up again to pee. These doctors are not fucking listening.
I remember when Drew had to do that a lot.
Yeah, when I had my prostate out, and I had
2 or 3 times a night. Yeah,
I had the catheter in and all stuff, so I went through a lot of stuff too. But now I am, half to 1 times a night.
Yeah,
If I drink, if we have fluids late in the evening,
we gotta work on that, Drew.
I stopped drinking that.
Yeah, if you don't drink anything after 6 p.m., you're much better.
Well, I stopped drinking at 6.
I used to wake up and pee, and then I just, you know what? I'm gonna try to just push through it.
You are.
But then you pee a lot more than I do.
No, this is whole other situation. You don't want a female.
No, I'm not talking about this guy. I'm talking about you.
You don't want a female genital tract. You don't want a female genital tract before the age of 50. You don't want a male genital tract after the age of 50. That's the truth. So I would work on getting some of these anti-spasm medication. I have a certain bladder spasm too from leftover from what happened to me. So that's some of what's going on. Yeah. But it's not to have had radiation and a prostatectomy and be up once a night is sort of extraordinarily good. Yeah, it's certainly good. So let's talk to Melanie. See what Melanie wants to ask.
It's such a hassle. It's sad.
Yes, we don't like it. Trust me, we don't dig it.
I know.
But for me, not drinking after
you weren't supposed to live this long.
How dare you? But that's true. Melanie, what's up?
Hi, Dr. Drew. Thank you for taking my call. I have a lot going on. I've had RSD and fibromyalgia for almost 20 years, and the doctors did give me all those drugs and narcotics. And I was on fentanyl, Xanax, Fioricet,
terrible,
morphine, and
I believe humbly that RSD, which is called reflex sympathetic dystrophy syndrome, or we just call it RSDS, is caused by opiates. Did you have the RSD before you got on the opiates?
Yes.
Really?
Mm-hmm. I fell off a curb and
chronic pain. Chronic pain, yes, but true RSD where the hand swells up and stuff, or whatever limit is. Did that start before the opiates?
Yes, I wasn't on opioids.
Right.
I had fallen off a curb taking my cat litter out, actually. And then a couple of days later at work, my hand froze, and long short of it, they thought it was carpal tunnel. And I was going to have to wait 6 months, and I was in so much pain. So they said I was going to have to do surgery, and I found other doctors, and they said, no, that's not what it is. And then they, of course, started the opioids and the shots, and nothing helped. So I was on 5 narcotics,
Awful.
the Dilaudid as well.
Lucky
for
you
10
survived.
years.
Lucky you survived.
Well, the doctors, when I finally moved back into South Orange County, they said, my gosh, we're surprised you're alive because your stomach is being eaten up from the inside out. So now I've been off of
That's
those.
not, by the way, that's not what would kill you. What would kill you are the medicines would stop you from breathing. Boom.
Yes.
You just stop breathing all of a sudden. And that happens
I completely
all
concur.
the time. But anyway, so now?
And so then they tried to put me in a hospital for 4.5 days. And because I went crazy from being on those drugs for 10 years, I literally just walked out. And I did it on my own for 1.5 years and survived it.
Wow. Good for you.
Anyway, so 9 years later here now, I don't even count. I now have spinal cord injury and I'm losing my facilities. I can no longer feel going to the bathroom very well with my bowel movements.
What was the
and
injury?
My urine.
What was the injury from?
Well, I don't quite know yet because the doctor that I went to, first of all, 5 years ago, the neurologist at Hoag said that I just had a pinched nerve and there was no big deal. Now, because I'm in agony and not on any pain pills, the doctors just have me on marijuana for my pain, which just takes the edge off. They said...
So let's talk about that phenomenon I was discussing earlier where the body is the source of overwhelming discomfort if someone has been sexually abused in childhood. Is that something that happened to you?
Oh, well, I was laughing as you were saying all this. I don't know actually if I was, but I was part of molestations. I was forced to do the Swedish showers. I was forced to do some sexual things.
Okay. So that's
I don't
sexual
know
abuse. You just don't know.
of everything.
Was there any reason that your body itself would have been a source of misery or pain during childhood?
Yes, yes, I was very badly abused. And then at 15, I was raped.
Okay.
So, and then almost being raped.
All right. So there you go. So that changes how your brain regulates and experiences pain discomfort from your body. You really should see a doctor that specializes in this stuff. There's ways to make that all more tolerable for you. There's treatment.
Well, I've just started with someone who deals with chronic pain, a therapist.
How about EMDR? Get some EMDR. Start with that. Just talk to him or her about getting EMDR so you can start to get your brain and your body back on the same page. Because right now your body is only the source of misery and frightening pain, and it's your experience of it is real. But the body is not giving you, the source of it is not as bad as what your experience is. Let's put it that way. And so again, you have to take these treatments. You must. It's very, very, very important. You got to do that. And just to mess with the medicines forever, it just doesn't make sense. Okay, I need to take a breather. These calls have been very interesting and difficult. Susan, any questions on your front?
No, but you definitely called that one out.
Oh no, I know it when they start talking to me. And so much like
and thank you for being so open and answering because sometimes people don't. They not really. Well, maybe.
Well, that's usual. But she's an adult and she knows what she's been through and stuff. But most people will tell you if you ask.
But it's so
most
crazy,
doctors do not ask, and that's what drives me crazy. I mean, you see how easy it is she knows what happened. It's horrible and it leaves some remnants, and you can treat those remnants.
Yeah.
So
interesting.
Yeah, it's just I don't
Good
know.
luck to her.
Oh my God, yes. I feel so bad for those patients because the medical system does not really do them justice. Not to say that magically EMDR is going to make you better. These are very complicated experiences that you went through, and it leaves an effect. It just does. And yeah, it does. And so naturally, there's going to be struggles with that. Let's see.
What's a Swedish shower?
Who said that?
She said she was in a Swedish shower.
It sounded like she said that I didn't ask questions, but it sounds like it was being naked with adults or something.
Oh.
Yeah, sort of something like that.
Oh, like a Swedish sauna or something?
Yeah, I don't know. It all sounded bad. I don't need the details. I just know that I didn't want to evoke her.
No, I know. I get it. I'm not asking her. I'm asking you if you know.
What is the story, Caleb, about contraceptive denial at pharmacy? Tell me about that.
I had just read, there was an article about someone who used, it was something about religious freedom, a pharmacist used it to deny someone emergency contraceptives, and the lawsuits and things that ensued from that, which I believe, if I remember correctly, this was something that started as a case a couple of years ago, but now it's just gotten a lot of spotlight recently.
So that is, to me, that is disgusting, because that pharmacist who's supposed to understand these things does not understand how this medication works. That's why it's disgusting to me. If he or she, is it a he or a she? Do we know?
I'm not actually sure. Yeah, I don't know. Yeah.
This pharmacist, if he or she decided to not allow any hormonal contraceptives, fine. I have no quarrel with that, because all the hormonal contraceptives have a remote potential, including the morning after pill. It's all the same. And it's also true of IUDs, which its primary function is to interfere. IUDs interfere with implantation. That's how they work. So you'd have to say no IUDs. You'd have to say no morning after pill and no birth control pills of any kind. If somebody takes that position, I can't argue with them. I think it's silly. I think it's not in the interest of patient care. I think it's imprudent, but I can't argue with it. That's a viable position. But if you take aim at the morning after pill, what's so-called emergency contraceptive, that works by suppressing ovulation, not by preventing implantation. And these idiots that tend to take aim at the morning after pill don't take aim at the IUDs, which, strictly speaking, prevent implantation. That's how they work. So, I get very upset about that stuff. So, do you have something to say about it?
So, no, remember we saw that article about IVF?
Yeah, I didn't quite understand what they were getting.
Well,
at,
they were saying, like, if a woman, with the new abortion laws, if a woman and a man, have freeze their embryos. So some people have to get 12 or 15 embryos frozen, and then they pick the ones that are
most viable.
No, the ones that have, because some people have more chances of bad outcomes with their eggs, so they have to pick the good egg.
Right.
What do they do? Are they allowed to throw away the rest? Because is that a viable child, and is that is that going to be in a law?
It's a really interesting question. I don't know.
And I mean, also what about all the frozen embryos? Are they allowed to?
There are a lot of people that treat them like they are potential lives. That is, but how long do you keep them?
And is that it's a life, but is it a really life?
And let's say you get to the point where you've kept them too long and they're no longer viable. Did you just commit a murder?
Yeah,
I mean,
that's what they're saying. Yeah,
these are goofy. These are goofy things. There is such a thing as prudential thought. What is prudent? There's prudence. There's reasonabness, particularly in biological systems. It's not so.
I mean, it hasn't even attached to the uterus. It's not even it takes a woman to make this all come together.
Correct, but the implantation. You just heard me yelling about that, right? Did you not understand what I was talking about?
No,
you didn't. So okay, because if you didn't, nobody else did. So what I was talking about was eggs are fertilized in the tubes, in the fallopian tubes. That's where they're fertilized. They sit there for 3 days waiting for sperm. After ovulation, the egg makes it into the tube and sits there for, on average, 72 hours. That's how long they sit there, right? Then, if fertilized, move down the tube and implant into the wall of the uterus, okay? Things that the implantation process is sort of delicate, and a lot of things can interfere with that. A lot of medication can interfere with that. IUDs are designed to interfere with that. Your birth control pill that you take every day can interfere with that. Emergency contraceptive can interfere with that with the exact same mechanism, even though they both work by preventing ovulation in the vast majority of cases. In the interest of prudence, why don't we let people use these things if there's remote possibility of implantation being impaired? If you want to get IUDs, get rid of IUDs, okay, whatever, I can't argue with that. But let people take the hormones. And by the way, you might have to get rid of some blood pressure medicines and other things too that might interfere with the implantation of an egg. And so this whole preoccupation with implantation has really far-reaching biological consequences. Am I making sense? And so, the fact that they're taking aim at the morning after pill and not the usual contraceptives and not the IUDs mean they don't understand shit about biology. And that bothers me, people that are clinicians especially.
And then what if you can't get an abortion and you have a tubal pregnancy?
They absolutely. You are allowed to have your life saved. You cannot survive a tool pregnancy.
No, you can't.
They would
I
take
had
it
one.
out. They would take it out. All the weird press around that is fake news. That's fake news.
Oh, okay.
That's fake news. They take it out. That's it. Let's see. I would never speak out against the narrative. It's not in my nature. Thank you, Iceberg Slim. I think you're giving me a compliment. I'm not sure. I don't speak out against things until I'm like, I speak out against the fact that there's no gravely disabled. I speak out against the fact that people can't get conservatorships. I speak out against my clinician peers not understanding how birth control pills worked. I speak out about those things. So things that I know for sure. I speak out against people using opiates that shouldn't be getting opiates. I speak out against the use of benzodiazepines on top of opiates. I'm 1,000% clear on all those things, so I can speak out as loud as I want. When things get more complicated, such as vaccine therapies in the middle of a pandemic, I try to avoid being hubristic. That's how I get into trouble if I'm hubristic. And so-called speaking out against the narrative is sort of like raising your voice when, it makes you look like you're taking a position that you're certain about. And again, biology is so complicated. It's hard to do that. Have I tried reaching out to BAM? I have not. It's been a long time since I've talked to him. Soon enough, abortion and pregnancy prevention will be a non-issue. No, I'm not sure. Boy. Okay, thank you guys. And let me just see the restream, what you guys are doing. JC, I'm not quite sure what you mean.
Can we talk about the show that we're doing on Wednesdays again?
Oh, sure. Let's do it.
Let's
Go ahead.
discuss it.
So Kelly Victory, Susan is producing a new show with me and Kelly Victory on Wednesday.
Well, we're just having her come on every week.
Right. We're gonna have her come on.
Same show.
Same show, but it's gonna have more extreme. I'm gonna be against more extreme positions than normal.
Yeah.
And because of that, we are probably going to do it all on Rumble. We are going to start on these usual platforms, but it looks like we will have to abandon YouTube pretty quickly.
Yeah, we got censored last time she was on. Fortunately, Caleb was able to get the show reinstated. So I think there's like actual people with consciences behind YouTube now. But honestly, if we're gonna, anybody who's on YouTube or Facebook, even for the future, if we get started on the show, we'll let you know. Head over to Rumble if you want to, if you like the topic, if you like the guest. If you don't like the topic, if you don't like the guest, don't do it. But you might actually tune into the YouTube show and find out that it was only like 5 minutes.
Right.
That means
we went to Rumble. I'll say it.
I mean, I don't want to get strikes on YouTube, but I mean, I'd like to see what happens.
Let me ask this, Caleb, is there a world where you call them, the people that you appeal to get us out of jail and say, hey, we're about to do this thing? No, you can't do that? No.
It used to be back in the old days when I started on YouTube, they had like a secret phone number and a secret email address. And once you were in, then you could get help from them. Like that's how I got youtube.com/Caleb. Like they would give you these short URLs and all this stuff. Nowadays, no. I was so shocked that they actually reinstated the video because it means that a human being actually reviewed it within 4 to 6 hours. So that could be them going in a good direction. Amazing. But we will probably definitely be starting the show on all platforms and then moving, slowly windowing it down probably to Rumble. Yeah.
I mean, I'm hoping our guest shows up tomorrow. He's kind of flaky sometimes, but
not tomorrow, the day after.
The day on Wednesday. But yeah, like he got censored on YouTube and on Twitter, and he sued them. So they're not going to like him very much over there. Obviously, Kelly's suing everybody, all these platforms for censorship over the last couple of years. She's been just attacked like numerous times. And we kind of want to address that, but also we're not trying to upset anybody. We just want to let people have free speech. And so when we do have the guest on, if it does look like somebody who was already censored on YouTube and the show's really short, it means we had to move over to the other platform.
Some people are asking for Justin. What's Justin's last name again? Justin, hold on.
And I know people are asking for.
What's that?
Justin Bieber?
Justin Hart is
Oh,
also
Outspoken
outspoken anti-vax dude.
Sure, yeah, we'll just get him. No.
Also, hang on, I got to
well,
say,
somebody wanted
just
Alex.
alerted me something that
Okay.
it's Robin Quitter's birthday, and I have to say happy birthday to Robin. I miss her, and I miss Howard, I miss the boys.
And somebody wanted Alex Jones, and I was like, no, thanks.
No. Also, Nicholas Gers, happy birthday to you as well.
But the beauty of Rumble is that they, you guys can come over there and watch. You can say whatever you want. You can yell at us. You can do whatever you want, and they won't take the show down. There's nothing more horrific than trying to do a broadcast and then having it censored. It's the worst feeling. And you're just like, well, what did we do? And then, of course, Caleb went in and said, what did we do? And they said, oh, really? Nothing. So here's your show back. But we don't want to do that. Like, right. I get really tired of this. But as far as, guests, we'll definitely, we'll push the envelope a little bit on Wednesday.
I have
because she does have.
I have about a minute and a half promo that I'll play at the end of the show, or I can play it whenever you guys want to show it with the clip and stuff like that, so they see what's coming up.
About Wednesday?
About Wednesday, yeah.
Oh my God, we should tweet that.
And
out too.
Drew's point of view is not going to change. He's always going to be.
No, hopefully they will change my point of view. I am interested in change. Me talking to somebody that agrees with me is nothing. It does nothing for anybody. But if somebody disagrees with me and it changes my thinking, like I'm telling you, I'm looking forward to talking to Naomi again, because her book got me thinking.
Yeah.
And I don't know if I agree with it or not yet, but it got me thinking. And
these people do a lot of research on what's going on in the world.
And
we don't have the capacity.
You invited
to do
David Gorski to give as much, sort of the other point of view. He tweeted something that I started to talk about a little bit earlier.
Did he respond?
I don't know, but he tweeted something that
I have a hard time with Twitter.
Grabbed. Hold on, I want to just tell you. Is Lab Leak conspiracy theory dead? You guys look for David Gorski and look at this article he tweeted, and he sort of was glib. It was sort of nasty about it, and said, of course, now people are they're dropping all the lab leak theory. But I read this article, and it was not that strong. It was well done. It was comprehensive, but it didn't prove anything. It literally had none of the things we need to really prove the animal source. And it did not find an intermediary. It did not see the transmission. All it was doing was really kind of suggesting that the structure was such that maybe it was zoonotic. And they even said it made 2 jumps into the human being in this article. And to me, that even makes it more likely it seems like something was leaking out or something getting out. But if it did make 2 leaks into the human being, then they sort of, I would love to see a map that showed where the lab was relative to what they were showing where the outbreaks got going. The outbreaks got going near these Wuhan, these markets, these wet markets. And my understanding is, I don't know this for sure, I'd like somebody to tell me, that the research facility was near that, or maybe there was people that worked at that research facility frequented the market there. So there's many unanswered questions that this article left behind for me. So I find it weird that people sort of call things as just done and done. And so things are much more complicated than we know. All right, so let's do this. Let's wrap things up. We'll be back at 3 o'clock. I'll start out on the usual platforms on Wednesday at 3 o'clock Pacific time. And let's see the promo of what you got for us, Caleb, for the Wednesday show. Incompetence, and then you're talking about business. You know how many businesses were just? There was a business here of hamburger stands like 3 generations old that now has it's all encased essentially in metal with a padlock on it because they dared to continue to serve hamburgers outside in violation of the public health mandate. This is weird.
That's disgusting.
This is not. I understand it wasn't normal times, but this was. If one thing, if it was fully justified, it just wasn't.
In addition to the tragedy and the travesty of what happened to hundreds of millions of people because of this debacle, the bigger concern now moving forward is, I've spent the last 2 decades in public health. What's going to happen when we sound the alarm bell about the next thing? Because there will be a next thing. There will be a next crisis at which time we need to get the attention and the buy-in of the American public and the global population. And they have essentially tuned out public health. There are people who will never, ever listen to a public health mandate again, because they've said these people are idiots, they're incompetent, they have nefarious intent, they're evil, whatever it is they think. But they sure as hell aren't saying, wow, you guys did such a bangarang job. We can't wait to listen to you for, guidance the next time around. There's nothing in medicine that doesn't boil down to a risk-benefit calculation. It is the mandate of public health to consider the impact of any particular mitigation scheme on the entire population. This is uncharted territory, Drew.
There we go. So that will be on.
She is so serious. I love her.
Susan is a huge fan of Kelly Richards.
Like she keeps going and going and going, but it just rolls out of her mouth.
All right. So you'll get more of that on Wednesday and every Wednesday for a while. And we'll see what we come up with, guys. We'll see if we all learn something or if we all debunk stuff. Maybe we'll learn that there's not as much there as we worry there might be. So join me on that. That'll be 3 o'clock Pacific time, Wednesday. Thank you, Caleb. Thank you, Susan, for setting this up here in New York. We'll be back in Los Angeles tomorrow evening. And I guess that we can wrap it up. Caleb, correct?
Hopefully it'll be tomorrow
See you guys
evening
then.
and not Wednesday a.m.
Right. See you then.
Ta-ta.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.
I mean, I stopped taking the Viagra because I couldn't get them no more. It's just getting expensive.
They are expensive. Did you take the 100 milligrams or the 50? Do you know?
I think it used to be the 100s.
100.
My heart used to be going crazy.
Yeah.
There'd been a few times I was laying in the bed like, God, don't let it end this way.
Did you?
Not with this bitch looking at the bed like, no, they gonna all laugh at me over this.